I will start the outline of my talk with a brief introduction of metal organic framework as drug delivery system, followed by some biodistribution and toxicity concerns, and then to highlight the importance of vectorization of the control the biodistribution for drug vectorization, I will present some results of MOFs administered by different routes: intravenous, oral, pulmonary, and cutaneous. Then finally, I will give you some examples of other biomedical and environmental application of these interesting materials. Well, what are the advantages of drug delivery system? Well, conventional system present the active ingredient concentration versus time. This kind of peak and valleys representation corresponding to either toxicity phenomena or absence of effect. In contrast, the control release system present a much better control of the plasmatic level, leading to higher therapeutic efficiencies and lower side effects. In addition, we can also protect the active ingredient inside the carrier, for example, and modify their properties such as the solubility, stability, and also its bioavailability. In this sense, we can control not only the delivery of the drug temporary, but also spatially targeting the active sites. Well, there are many nanomedicines that are already used in clinical. However, there are still a huge number of drugs or active components that fail in clinics because they are not successfully administered. It's for that reason, in 2006, we proposed for the first time the use of metal organic framework as an alternative method to deliver the drugs. What are the metal organic framework? They are crystalline coordination polymer built from inorganic units that can be almost of all the cations in the periodic table as a form of atoms, cluster, chains, a layer connected by organic polydentate ligands, which are also quite varied, such as carboxylate, phosphonate, azolate, or so on. This, the combination of these two parts leads to the creation of a three-dimensional network, usually porous, and this material presents exceptional porosities, even reaching the area of a football match area. And we can see this porosity is characterized by a narrow micro and mesoporosity and a very high internal surface area and pore volume, which are well adapted to the absorption of a large number of molecules, and also a highly versatile hybrid composition, which is also adapted to a large number of adsorbents. Due to these properties, this material has potential industrial application in several fields, such as fluid separation, gas storage, catalysis, and so on, and among others, in biomedicine and environment. Well, from my point of view, one of the most promising material for drug delivery in biomedicine is the called MIL100 iron. This material is based on this iron 3-octahedral trimer connected by the trimesate ligand, leading to this hybrid supertetrahedra, which can be considered as equivalent to the silicon or aluminum tetrahedra in the zeolite. This hybrid supertetrahedra will assemble into a cubic zeotype structure, which can be represented schematically like this, and in which we can see two different mesoporous cavities accessible through microporous windows. This material presents an exceptional porosity with pore volume larger than 1 cubic centimeter per gram, associated with a large capacity of storage, and also the presence of iron 3 Lewis acid sites that can also interact strongly with the adsorbate. In addition, we are able to produce the MIL100 as a form of nanoparticles of around 140 nanometers, compatible with the intravenous administration, reaching very important space-time yield, so a high production, by a simple and very fast and totally green microwave synthesis. Well, what are the requirements for the real application of MOF in biomedicine? Of course, the first is the toxicity, the absence of toxicity, and this is related with the biodegradation of this material. The material has to be enough stable to perform its function, but we should avoid the accumulation in the organism, so the material has to degrade, biodegrade, and be eliminated from the body to avoid the accumulation and then the toxicity. Of course, the material has to exhibit good performances. This means high loadings and progressive release of the active carbon core. In this case, targeting real challenges without forgetting also the understanding of the processes to improve their performances. And also a precise control of the biodistribution to reach the target sites, increasing the efficiency and decreasing the toxicity effects. This is, of course, related with the suitable formulation, which is associated, and we have to consider both the active ingredient and also the administration route. Well, starting with a few words about the toxicity, pharmacokinetics, and biodistribution of this material. As you can see here in the pharmacokinetic graph, we can follow the concentration of the MOF, of the nanoparticles in blood, immediately after the administration. We can see a peak in the concentration at the maximum, and then rapidly the concentration in blood decrease, almost disappearing after 2 hours. This is due to the absorption on the outer surface of the particles of the serum proteins opsonins, which are responsible for the recognition of these foreigner nanoparticles by the macrophages, removing them from the circulation by phagocytosis. These particles will accumulate mainly in the reticuloendothelial system. This is normal for all the nanoparticulate systems. And in liver and in spleen, we can find after 24 hours of the administration more than 60% of the administered dose. It's also interesting to see that the presence of these particles in the kidneys, which is also associated with with the removal of the ligand by the urines. This is an important fact because both the metal, the iron excess, and also the ligand can be removed without any metabolization by urine and feces, avoiding the accumulation and then the toxicity effects associated by the accumulation of the materials. Well, once we have proven the lack of toxicity, the biodegradation, the biodegraded character of this material, we can also encapsulate or concapsulate the drugs by different strategies. Schematically, we can introduce the active ingredient either by diffusion into the channels, also by grafting on the outer surface of the MOF, also by forming the MOF in situ around the active ingredient, or finally by using intrinsically active either metal or ligands to form a bioactive material. The release of the cargo, the active cargo, will be a combination of the diffusion through the pores, drug matrix interaction, and also the matrix degradation. The matrix degradation will be the main determinant factor in the case of the encapsulation in situ or the biomorph strategy. Okay, once we have proven the lack of toxicity, we have encapsulated many different drugs by the impregnation method. So inside the porosity, in which we can target around from 10 to 50 percent in weight of challenging drugs such as antitumoral, antibiotic, antiretroviral, and so on, in some cases exceeding the capacity of liposomes and polymers. And you can see here, for example, the doxorubicin and antitumoral or the acidotimidine triphosphate, a progressive release in 5 and 14 days. In some cases, we can observe also a very fast release in the first 30 minutes or an hour. And in this case, we can slow down the release and control better this progressive delivery by modifying either the structure. In this case, for example, this was the delivery of 100. However, if we use another material, also an iron carboxylate, but with a different structure, in this case, it's a flexible porosity in which the porosity can adapt the pore size to the adsorbate, to the drug, reducing the diffusion through the pore and better controlling the delivery. Also, we can introduce in the material some additional functional group that, in this case, for example, an amino group in this material can promote an additional interaction between the drug and the matrix, increasing the heat of absorption, so the drug-matrix interaction, and leading to also a better control release. However, we have also to target, really target the organs and the tissues, the illness. So finally, for this reason, we need to really adapt the conformation, the administration route, and the formulation of this material. Here I will show you some different examples considering different administration route. The first example is a passive targeting of lungs to treat cancer, that considering the important annual death incidence of lung cancer is a challenging objective. To do so, the gemcitabine monophosphate was encapsulated in the 100 nanoparticles, reaching up to 30% in weight. The activity of this antitumoral drug is limited by its hydrophilic character, which hinder its cell internalization. This could be solved by encapsulating the drug in a nanocarrier able to deliver the cargo intracellularly. Thus, upon the intravenous administration of these nanoparticles, the nanoparticles accumulate in the lung. Here, the histology of the lungs, in which you can see the nanoparticles in blue after the Prussian blue staining, which specifically color the iron in blue. You can see the accumulation after 30 minutes of the material, and then a progressive removal from this tissue. This is a consequence of a pH-responsive formulation. You can see here the hydrodynamic diameter of the particles. They are quite colloidally stable under acidic pH, but at the pH of the blood, the nanoparticles aggregate in larger aggregate that they will be retained in the small capillaries of the lung. If we follow also the concentration of the gemcitabine monophosphate in the lung, we can see quite a higher concentration when the gemcitabine monophosphate is administered inside the nanocarrier when compared with the free gemcitabine. Further, if we evaluate the if we evaluate the in vivo activity in a mice metastasis model, we can observe that after the administration of these nanoparticles intravenously, we can observe that not only the number of metastases, but also the mass of the tumor decreased significantly when compared with the gemcitabine administered alone or with the other control group, making a quite nice and promising formulation for the treatment of cancer, lung cancer. The second example concerns the first pulmonary formulation of MOF and their in vivo testing. Here, the anti-tuberculosis isoniazid was encapsulated in the 100, and then using the mannitol as an excipient, we were able to produce microsphere compatible with the pulmonary administration. Upon the pulmonary administration by inhalation, the nanoparticle were detected in the lungs with an homogeneous distribution. See here we can observe an homogeneous distribution of the particles along the lungs, making this formulation quite promising for the administration of not only pulmonary drugs, but also systemic drugs. Concerning the easy and convenient oral administration, the 1100 nanoparticles containing the genistein antitumoral drug with some drawbacks associated with low solubility and bioavailability were administered orally to rats. Again, here we have the genistein can be released progressively under physiological conditions, and upon the administration, the oral administration, we can observe in the pharmacokinetics, we have demonstrated that the drug concentration in plasma when administered in the formulation is higher, and also it's prolonged in the time when compared with the formulation with the free genistein. In addition, the first preliminary biodistribution test shows that the genistein concentration in liver was half that of the free drug. Therefore, the MOF seems to protect the genistein from the metabolization, acting as a shelter for a genistein. As cutaneous formulation, we can mention the combination of an anti-acne therapy based on the nicotinamide and the azelaic acid. Both were encapsulated into the 1100 nanoparticles. And here you can see that that by a very simple press molding method, we were able to perform a patch compatible with the cutaneous administration. And as you can see, both drugs are progressively released from the formulation with a more controlled release than the pure polymeric patches, the MOF acting as a kind of reservoir of the drugs. In addition, we can also follow the skin retention and permeation using an ex vivo model based on the pig skin. And here you can observe that the azelaic acid exhibits an improved permeation when compared with the polymeric controls. And also when compared with the commercial formulation, we can see that the nicotinamide presents a more controlled diffusion, and the azelaic acid a diffusion flux within the range of the commercial devices, making this combined formulation a highly competitive. Further, the good biocompatibility of this patch was pioneeringly demonstrated in human. As you can see here, there is no irritation after 4 and 8 hours in contact with the skin. So finally, as an alternative to release drugs is to incorporate the drug as a constitutive part of the MOF, not in the porosity, but in the network. This is an interesting approach if we consider that more than 80% of the active molecules present complex zinc functions. This is the case, for example, we can associate the azelaic acid with the zinc, both with antibacterial, anti-inflammatory properties. And as you can see here, we can create a three-dimensional framework with a complementary activity. Not only both ingredients, zinc and the azelaic acid, can be released in either water or cell culture media in a very, very progressive and controlled release. This is more than 6 months, which is compatible with clean surfaces, for example. But also here, the interesting thing is, if we compare the minimal inhibitory concentration in contact with different bacteria, we can observe that the concentration of the MOF required to do the same action, killing the bacteria, is much lower than the azelaic acid. So in this case, we have an additive activity. Okay. So this is useful also for the biofilm inhibition. The biofilm, as you probably know, it's bacteria colonies attached to a surface and protected by an extracellular polysaccharide matrix. This is very useful to to apply in different fields such as medicine, food industry, and so on. Here we have selected a titanium MOF in which we associated silver nanoparticles. You can see here the association. And if you can see here the formation of the biofilm in contact with either the control group, a glass surface, the surface covered by the MOF, and the surface covered by the composite, either under dark or under irradiation. You can see that under irradiation, both the MOF and the composite seems able to avoid the biofilm formation. Even further, if we check the viability of the bacteria at the free state, the planktonic bacteria only attached to the surface bacteria, we can observe that the MOF and the composite present both an anti-fouling and antibacterial effects improved upon irradiation. Even the electron transfer between the silver and the MOF might be responsible of the effect, since the physical mixture of both components has no the same activity. So it's really a combination of both material inside. So another application that we have recently proposed for the first time is the use of MOF as oral detoxifying agent. In fact, upon the accidental or voluntary ingestion of a toxin, we can propose the administration of micrometric iron MOF as an absorbent to avoid the toxin absorption, the gastrointestinal absorption of the toxin. Okay, thus, after 1 hour of a rat oral overdose with aspirin, the second cause of pediatric fatalities, the MOF was orally administered. And we have seen that the MOF is able to reduce the drug absorption. In this case, not only the plasma level are 3 times lower, but also the MOF, the presence of the MOF, is able to protect the intestine from the toxicity of the aspirin. In this case, the toxicity of the aspirin leads to the destruction of the pilosities. In presence of the MOF, here you can see that the pilosities remain intact. So the MOF is also stable along the gastrointestinal tract, observing even in the feces the presence of the particles, intact particles containing the contaminant. And also, if we compare the performances of the MOF with the commercial carbon, activated carbon, we can see that the activated carbon present higher efficacy under gastric condition than our MOF. However, the drawback of the carbon is that despite the important gastric absorption of the salicylate, once it passes to the intestine, it releases the cargo, allowing again the intestinal absorption of the toxin. In contrast, our MOF absorb and retain the salicylate along the gastrointestinal tract, avoiding their absorption and toxicity. And finally, I would like to present another application in the environment, the water remediation. We could also use the exceptional ability of MOF to encapsulate drugs for environmental applications, such as the water decontamination. As you know, the pharmaceutical and personal care products are present in water, rivers, seas, and so on, leading to serious and harmful effects on the environment. MOF can selectively absorb the contaminant. Here we have selected the atenolol, an antihypertensive drug widely used, and in presence here of the MOF, you can see that atenolol was totally, completely removed. Almost, the removal was almost complete and very fast, being even more effective than the currently applied carbon, activated carbon. Even if we go one step further, we have packaged the MOF into columns, and we have performed the breakthrough curves using continuous flows compatible with wastewater treatment plants. The MOF column efficiently removes the atenolol in continuous flow up to 12 days while remain stable, acting as a highly efficient and promising absorbent. Finally, I would like to conclude, well, iron carboxylate MOFs are safe even after the administration of very important doses. We were able to formulate the MOF in devices compatible with intravenous, pulmonary, oral, and cutaneous administration. MOF formulation has demonstrated high efficacy against challenging disease and in cosmetics. And MOF can be used as a novel and efficient oral detoxification agent, and they can also be proposed as an efficient detoxifying agent in the removal of emerging contaminant in wastewater. I would like to thank to all my group in their energy in the Advanced Porous Material Unit, also all our collaborators in Europe and abroad, and of course, all of the foundings and all of you for your attention.